We're excited to have Dr. Gavin Setzen with us as our presenter today. Dr. Setzen is a well-known practicing otolaryngologist serving as president and managing partner of Albany ENT and Allergy Services in Albany, New York. He has an extensive background and resume, having served as past president of the American Academy of Otolaryngology Head and Neck Surgery, past chair of the Board of Governors, and past secretary treasurer of AAO. Dr. Setzen was recently elected to a 5-year term as director to the American Board of Otolaryngology. He is also a past president of the New York State Society of Otolaryngology. Thank you, Dr. Setzen.
Good morning, and thank you for this opportunity. I'm going to talk about the clinical and economic value for payers as it relates to LATERA, an absorbable nasal implant system. We'll talk briefly about the patient's perspective, the impact of compromised breathing, nasal airway obstruction as it relates to nasal valve collapse, the diagnosis and treatment of nasal valve collapse, some of the diagnostic codes and Category 1 CPT features, a little more about LATERA based on economic evidence as well as the clinical evidence. And then from the payer perspective, looking at the financial burden of breathing and sleep disorders, finishing out with a brief summary. Nasal airway obstruction is a significant issue from the patient perspective, and an overview of nasal airway obstruction is helpful when one considers the symptoms that we all experience at different times: nasal congestion, nasal stuffiness, impact on physical activity, nighttime breathing, sleeping. We know that there are significant impacts as it relates to quality of life, and patients typically do poorly on nasal airway obstruction validated questionnaires. We know also that nasal blockage and nasal obstruction impact sleep, and that excessive daytime sleepiness is a significant complaint in patients with nasal airway obstruction, and how that relates to other general health issues, impact potentially on sleep disordered breathing, obstructive sleep apnea, and the like. In addition, it's important to consider nasal airway obstruction prevalence and what contributes to this. There are several factors. 80% of patients will have a deviated septum. 77% of patients have inferior turbinate or other turbinate hypertrophy. And 73%, a significant number, have nasal valve collapse. And 82% of those patients will complain of severe or extreme nasal airway obstruction due to untreated nasal valve collapse. So this is a clinically significant issue leading to nasal obstruction, functional performance impact, quality of life, sleep, and daytime sleepiness as well. Now, the American Academy of Otolaryngology provided guidelines back in 2010 through a clinical consensus statement that talked about nasal valve collapse as a distinct clinical entity separate from other anatomical components of nasal obstruction. It discussed the fact that the nasal valve includes both the external and internal cross-sectional area of the nasal cavity, and anatomically, physiologically, and by virtue of the physics, this region presents the greatest overall resistance to airflow and is a dominant primary determinant for nasal inspiration, hence nasal obstructive symptomatology, impact on daily function and sleep as well. And we see both static and dynamic components to this. It's important to differentiate the new 2023 position statement, which distinguishes two important factors. The fact that, number one, failure to perform nasal valve repair when indicated is a common cause of incomplete symptom resolution in patients with nasal obstruction and nasal valve dysfunction. And secondly, requiring septoplasty and or turbinate surgery prior to nasal valve surgery is not recommended, as this may lead to unnecessary increases in surgical encounters. And this is oftentimes managed in combination with other surgical procedures. So this is a really important differentiation. It's also important to mention the fact that the physician or clinician has a significant role in our ability to diagnose specifically nasal valve collapse as part of the overall nasal airway obstruction dynamic. A good and thorough history, followed by a physical examination, both anterior rhinoscopy and nasal endoscopy, together with the modified Cottle maneuver, a maneuver demonstrated on the right side where a Q-tip or wax curette is placed in the nasal cavity. Gentle support is provided to identify nasal valve collapse and potential symptom improvement in real time during the clinical examination with that patient, helps to differentiate internal and external nasal valve collapse. One may require imaging, and certainly the addition of validated symptom scores using the nasal obstruction symptom evaluation or NOSE score is important to establish severity, and is also a validated standard of measure of effectiveness in patients who are treated either medically and certainly surgically as well. Since the introduction effective January 1, 2021 of Category 1 CPT code 30468, which reports bilateral nasal valve treatment effective October 1, 2024, when new diagnosis codes will be added. This is important because it allows the clinician to identify, accurately diagnose, and track these patients. And it also provides a mechanism for the payer to more accurately follow these diagnoses with respect to accuracy of diagnosis, utilization, and other important components as well. And other payers are already requiring the definition of both internal and external static and dynamic nasal valve collapse in their medical policy, and this should help facilitate that process. So nasal valve collapse treatment options are varied. There are non-surgical and surgical. We know that many patients have tried nasal strips, dilator cones, a variety of medications, nasal sprays, decongestants, steroid nasal sprays, antihistamine nasal sprays, and so on. These are somewhat helpful and in some patients can be effective. They require daily use. There are side effects associated with this: intolerance, compliance issues, cost, and these are not reliable long-term solutions. The gold standards have typically been surgical, including open rhinoplasty, as demonstrated in the bottom right of this slide. And you can see that these tend to be much more morbid, significant procedures done under general anesthesia, literally opening up the nose, unfurling the nose to identify the cartilages, the upper and lower lateral cartilages, to facilitate treatment. In the top right of that slide, you see cartilage grafts, alar implants, whether it's a cartilage graft, a titanium implant, or other, are often used. And the surgical treatments address the external and internal nasal valve, but again, many require general anesthesia. There are functional problems after these surgeries. There are aesthetic problems. They are not without morbidity. There is incremental cost and complexity from the patient and provider perspective, as well as the payer. And so these are really the variety of opportunities available, but one has to consider the benefits associated with LATERA, which is an absorbable nasal implant system that has demonstrated both safety and efficacy as well as durability in multiple clinical studies, and we'll assess those in a moment. And here you see the novel device for inserting the absorbable nasal implant. It supports the cartilage at both the internal and external nasal valve to reduce nasal airway obstruction, and it stabilizes the lateral nasal wall. It definitely identifies or has been shown to be effective with high patient satisfaction. 86% of patients were satisfied with nasal breathing afterward, and 93% of patients were satisfied with their clinical appearance. The results are durable beyond 24 months. And so these are very important considerations when considering this alternative. So in summary, there are 8 clinical publications. There's one health economic real-world evidence claims data cost analysis with reduction in total cost of care, a randomized controlled trial with long-term follow-up, 24-month durability in multiple clinical studies. And as mentioned earlier, as it relates not only to nasal airway obstruction patients, but in clinical health, cardiovascular, and other implications of abnormal Epworth Sleepiness Scale score, sleep-disordered breathing, potentially sleep apnea, with demonstration of clinically significant improvement in ESS scores, and also the fact that this was referenced on UpToDate and ECRI showing favorable. When one considers the real-world health economic evidence, it's important to note that the total cost on an index date of treatment, payers save $2,230 per patient. And this is important when you consider LATERA cost versus the surgical repair referenced earlier. And a subgroup analysis shows $100 per patient per month savings in patients who underwent LATERA concomitantly with septoplasty and inferior turbinate reduction. This was accepted for publication in Medical Economics and looked at 5,000 patients treated with LATERA versus 26,500 patients treated with surgical repair options. The LATERA clinical evidence overview, the data is substantial, and as one can see, there are multiple clinical studies showing very similar positive results. LATERA has been studied in multiple sites of service, the office, the operating room, as a standalone procedure, and concomitant with other surgical procedures as well. There is a 3-month RCT with 24-month durability and multiple studies showing 24-month durability. And as you can see from the plethora of data, safety, efficacy, and durability have been demonstrated repeatedly, supporting the favorable outcomes with LATERA based on the clinical evidence. In addition, the clinical evidence overview as it relates to nasal symptom scores, we talked about the nose score demonstrating significant improvement, very high responder rates, improvement in the visual analog scores as well as demonstrated here. But I alluded earlier to improvement in Epworth Sleepiness Scale scores. As we know, across the clinical spectrum, the importance as it relates to sleep-disordered breathing, and we were able to demonstrate clinically significant improvement in ESS scores as well. So as it relates to sleep improvement and the long-term benefit sustained over 24 months, this is important as it relates to patient safety, ability to work, daytime function, performance, travel, etc. Patients exhibiting EDS prior to LATERA demonstrated clinical improvement in their ESS scores. And as you can see, These were significant. Patients with abnormal ESS scores greater than 10 had a mean improvement of minus 4.9, and cannot ignore the positive impact on sleep quality and as how that relates to general health and daytime function as well. There's an important study that warrants discussion looking at LATERA absorbable nasal implant compared to functional rhinoplasty. As I demonstrated earlier, this is a much more morbid procedure requiring surgical incisions, general anesthesia, with both functional and cosmetic impacts and potential for complications. Here, this study demonstrated clinical evidence that LATERA was non-inferior to functional rhinoplasty techniques, with significant improvement in baseline nose scores for LATERA compared to rhinoplasty, and overall the average nose score improvement of 40.5 compared to 40.1 for the rhinoplasty group. In addition, based on the data, the American Rhinologic Society has come out in support of the use of a bioabsorbable nasal implant for treating 30468, and have stood behind the comment that this procedure should not be considered experimental, but should be considered an effective option in treating nasal valve collapse. The American Academy of Otolaryngology Head and Neck Surgery has also stated that nasal valve repair is inappropriately selected patients is an effective form of symptom relief, improving quality of life, and when nasal function is compromised and dysfunction diagnosed, conservative therapy may include nasal cones, etc. However, those are not feasible around the clock and are not viewed as a viable long-term treatment. Therefore, the nasal valve may be stabilized using office-based treatments such as implants, and failure to perform nasal valve repair when indicated is a common cause of incomplete symptom resolution, with persistent problems for patients with nasal obstruction and nasal valve dysfunction. There is a lot of information relative to the CPT codes, other payers, reviews. We know that this is covered by integrated payers like Kaiser and UPMC. We know that this supports both the internal and external nasal valves. This has been referenced on UpToDate, and it's important to note that this has the second highest rating with ECRI based on data without the real-world evidence data, and that local coverage articles for Novitas, Palmetto, and First Coast have been referenced as well. So in summary, there's new economic evidence demonstrating payer savings in comparison to open surgeries and other techniques. The new diagnosis codes will enable providers to accurately diagnose and report on nasal valve collapse care, and this will help payers to appropriately track care, utilization, etc. The new clinical evidence shows that LATERA is an effective treatment, as effective as surgical options, and that the robust body of clinical evidence, including the RCT, demonstrates consistent patient benefit, efficacy, safety, and durability. We've demonstrated the medical society support of nasal valve collapse and access to 30468 from the American Rhinologic Society and the American Academy of Otolaryngology Head and Neck Surgery. And we do see that US commercial payers are certainly starting to see the value of LATERA to the system, and in particular to the patients that we all care for. So we respectfully request that you consider this new information in your upcoming review as it relates to CPT 30468. And I thank you for your consideration. Thank you.